revolutionizing medicine with ChatGPT. How ChatGPT is changing the way we think about healthcare.
GPT, or Generative Pre-trained Transformer, is a type of artificial intelligence that has the unremarkable ability to generate human-like text. Keep in mind that this technology is currently in the beta testing phase. It is important to note the limitations. The quality of the responses depends on the quality of the prompts the user enters in GPT. The answers are not always correct. The answers are to be created to feel correct to humans. If the user does not know the area in question, then the answer might be incorrect, and the user may not be aware that it is incorrect. If the data entered is biased, then the data expressed by GPT can be biased. As a result, GPT may not be able to answer. One example of how GPT can be used in medicine is the creation of virtual assistants for patients. These assistants can provide personalized recommendations and advice to patients based on their medical history, current symptoms, and other relevant factors. For example, a virtual assistant could suggest over-the-counter medications or home remedies for a patient experiencing a cold or flu, or provide information on managing a chronic condition such as diabetes. Another potential use of GPT in healthcare is in the creation of personalized treatment plans for patients. By analyzing a patient's medical history, current symptoms, and other factors, a GPT-powered system could generate a customized treatment plan that considers the patient's specific needs and preferences. GPT could also help healthcare professionals with daily tasks, such as transcribing medical records or generating reports. By using GPT to automate these tasks, healthcare professionals could save time and focus on more important tasks, such as caring for patients. For example, a GPT system could be trained to transcribe patient medical records accurately and efficiently, freeing up healthcare professionals to spend more time interacting with patients and providing care. Additionally, it will be important to consider privacy and security concerns when using GPT in healthcare, as sensitive medical information will be involved. Measures such as encryption and secure data storage will be necessary to protect patient privacy and ensure medical data security. Physicians are already using this technology. The most popular example that went viral is on December 13, 2022. Dr. Clifford Sturmer posted on TikTok on using ChatGPT to save time with insurance denials. Get you the care they need. In the video, he asked ChatGPT to write a letter to United Health asking them to approve an echocardiogram on a patient with systemic sclerosis. Make references to supporting scientific literature and list the appropriate articles. It is important to note that he later posted a video telling healthcare providers to check the references that GPT yields. He notes that it is better to cite your own known reference to use with GPT. Overall, GPT has the potential to greatly improve the efficiency and effectiveness of healthcare by providing personalized recommendations and treatment plans to patients and helping healthcare professionals with their daily tasks. While there are challenges to overcome, such as the need for accurate and up-to-date data and concerns about privacy and security, the use of GPT in healthcare holds great promise for the future. Some possible future applications of GPT in healthcare could include using GPT-powered chatbots to provide mental health support to patients, or using GPT to generate personalized exercise and nutrition plans for patients based on their individual needs and goals. GPT could also be used to help healthcare providers with tasks such as scheduling appointments or managing patient records, making the healthcare system more efficient and effective overall. The potential for GPT in healthcare is vast, and it will be interesting to see how it is used in the coming years to improve patient care and the overall efficiency of the healthcare system.
Thanks for watching, and please follow me at Harvey Castro, MD. All right, guys. Well, welcome. My name is Dr. Castro, and I'll be putting Amy on here in a minute. Just wanted to welcome everyone. I just played a quick little video about ChatGPT. Hopefully, you guys got to listen to it. Just know that this is being recorded. Today's talk is basically unlocking the potential of ChatGPT and healthcare from a legal perspective. And so, the reason I put the video up front is because I wanted to go through my portion quickly, and I'm going to go over some slides, and then I'm going to bring Amy in to kind of go over it. My idea about ChatGPT is more of a pie in the sky, what I think could be one day. Um, Amy's been amazing in that she's going to come through and kind of explain, what from a physician's point of view, what I can do and not do, and I'll let her go over that. And so when you listen to me and certain things that I'm saying, just know that's obviously none of this is FDA approved. These are just things that I think as a physician, we need to be the leaders, or healthcare providers need us to be the leaders so that we can make a difference. And so I'm excited to have her. So let's see. Let me change slides. So bear with me. All right. So the way I look at ChatGPT and the easiest way to kind of divide things is, let's look at it. I'm assuming a couple things. We've all heard of ChatGPT and what it does. So I'm going to divide it into preclinical, meaning before we see the patient, clinical, when we see the patient, and after, just to kind of help divide it up in our brain. And so some of the things that I see eventually being the case, preclinical, would be, imagine the world in that, you go to see your physician, but you don't know what to ask. And so ChatGPT, you could go in and say, I have a medical condition, it's diabetes. What are the best questions to ask for my physician? And so I'm coming to see my doctor with these special questions that are very thought out, and it helps make that interaction a better interaction. From a doctor's point of view, it would be nice, especially I'm an ER doctor, it would be nice to be able to, obviously, I know there's HIPAA and all that, but in the ideal world, again, to be able to take this data of a patient that comes in sometimes that I've never seen, with volumes and volumes of data, and be able to put it into a system that could create summaries like ChatGPT could. And so, for example, I remember seeing patients with 5, 6 MRI reports. It'd be nice to be able to put it in the system, have it come through, and then give me a summary of what I need to know about each particular MRI result. That's just quick examples of preclinical. The next one is, sorry, seeing the patient. So on the next one, when I'm actually seeing the patient, obviously we talked about analyzing the records, but it would be nice to be able to use ChatGPT to run in the background. Again, barring HIPAA rules and all that, but some kind of system. And in the background, ChatGPT is able to listen to the patient, see what kind of symptoms the patient is saying. Sometimes the patient may say certain things, but then to be able to pick up on that inflection in the voice. Obviously, I'm doing it myself, but imagine an ER doctor that may be working there. It's 3 a.m, may not be at their best, being able to pick on things, little subtle things. And so having ChatGPT in the background, looking, listening, saying, okay, this is part of your differential diagnosis, that these diseases are coming up based on the patient's inflection. Or sometimes as a physician, you think, hey, the patient's coming in for X, but in reality, they're coming in for Y. But having a background, basically a virtual assistant telling you, no, actually, these are the cues that they're saying, and here's why, that would be really helpful as a physician. Obviously, in the ER world, I'm going to use this more as a specific. There's times that there's outbreaks. I remember a colleague of mine mentioning that Ebola hit in Dallas, Texas, and unfortunately, he let that patient go home, and it ended up becoming an outbreak. How nice would it be to have a system that is continuously talking to us, that says, "Hey, you know what? Across town here, X disease was diagnosed. Just be on a lookout. There's a food outbreak, salmonella. There's all these people having gastroenteritis issues." And so that kind of system in real time would be amazing to have. The next one is just seeing the patient. I already mentioned the food poisoning outbreaks. Flu outbreak would be another one. The other one would be patient experience, customizing it to what we call that, with the patient. For example, when I see a patient with diabetes, the way I treat them with a 10-year-old is way different than someone maybe in their 80s, different medicines. Being able to customize that patient experience using ChatGPT could be huge. And we'll go into that later. Next slide. So post visit. So, again, some of these things that I'm saying, obviously, as a physician, there's this issue that I want to go over, which is called the hallucination effect, or where ChatGPT may say something and you look at it and you're like, wow, that sounds good. But if you're not a trained professional, meaning if they're talking about some particular disease and in layman person may look at it and say, yeah, that sounds valid from ChatGPT. And so I caution people that anytime they do use ChatGPT, obviously it's not issued as a medical device. Do not use that as something that you think, okay, this is a replacement to my doctor. No, instead look at it as this is something that we're wanting to use for helping patients. And my whole thing is in medicine, it's all about educating our patients. So the more we know about a disease, the more proactive we can be about a disease, the more we can help our patients. So, for example, a simple example would be someone that has diabetes that's not eating well, that perhaps needs to eat well. So the doctor could go through and say through ChatGPT, give me a diet plan for a patient 3 days a week, 3 days, 3 times a day for a whole week. And the ChatGPT will give it, and then say, hey, the patient has gluten allergies. So then they would modify the diet. The next thing you could do is say, I need a grocery list for those 5-day diet. It'll give it to you. The other thing you could do is like, hey, my patient needs to do exercise. You could put into ChatGPT, I need a patient that, let's just say this person can use upper arms for some reason. So then you can say, I need a program to help my patient. They're going to work out 3 days a week, 30 minutes, but no upper arms exercise because they have a bad deltoid or something. It can make those customized adjustments for our patients, which I think would be amazing. Let's see. Then, like I mentioned, education would be the other quick one for ChatGPT. I see medical students using this for flashcards, a lot of data out there. For example, sometimes we get these big volumes of research papers. We might have put it into the ChatGPT and then give me a one-page summary of all the high points. With medicine doubling every 72 days, it's hard to keep up with all the things that are coming. So this is one way that I think you could keep up with your education, learn. And then as things come and change, obviously ChatGPT has been updated until the year 2021. I really think that the next edition will give more features and it'll be more powerful. And then one of the other issues is not giving references. I think the next edition will give references to each issue. So I'm gonna bring on Amy, and I'm gonna put on her slides here, and let me bring her on. Welcome, Amy.
Welcome. Thank you, Dr. Castro, for inviting me to this. And, I was listening to your summary of all the use cases in healthcare, and I want to point out that I think we already have the technology today to fix a lot of the problems that are in healthcare. And one of the big hurdles to doing that is the regulation. So we're in a state right now where we need to figure out how to take the existing technology and fit it into the regulations and hopefully amend the regulations to better support the use of the technology. So when you were going through some of those examples, and particularly talking about patients in the office and how a physician might be able to use ChatGPT with a patient in the office, what kept coming to my mind over and over again was HIPAA, because of course that is the federal privacy rule that is applicable to most healthcare providers, not all, but generally when you go to see your doctor as a patient, HIPAA is going to protect your medical information. And your medical information is not just your name, but it's any information about your health or healthcare payments that is connected to identifiable information. So it's your name, it can be dates, for example, surgical dates or office visit dates. It can be other information that I won't go into now. There are 18 different identifiers, in addition to anything that could individually identify a patient. So it's a long list. But when we're talking about having ChatGPT listen into a conversation between a doctor and a patient, it would be very surprising if there wasn't information disclosed that was protected by HIPAA. And if we're thinking about a doctor using ChatGPT to summarize medical records, for example, there is going to be HIPAA protected information in those medical records. So ChatGPT, in order to be used in those settings, would need to be HIPAA compliant. And right now, it's my understanding that it's not. There are AI tools in healthcare that are HIPAA compliant that can be used by doctors. But right now, with ChatGPT in the stage that it's at, it's not there yet. So when we're talking about using ChatGPT to interact with patients, for example, as a chatbot to maybe schedule visits, that is not something that ChatGPT would be able to do until it becomes HIPAA compliant, because the patient has to provide identifiable information in order to, say, book a visit. It doesn't help the doctor's office at all to get a request for a visit with no idea who the patient is. That would be very silly. So we need HIPAA compliance in any of those situations where we've got protected health information. One of the other interesting problems, as you mentioned with ChatGPT, is the reliability. So we know that it will return information that's incorrect. We know that it can return incorrect calculations, for example. We know that it can return incorrect information from citations. And so that's something that we need to be very careful of. And I think, as you mentioned, there are modifications that can be made to allow that to perhaps be corrected. And then, we've got to look at bias as well, because we don't know the information that trained ChatGPT. So if we have a patient, if you as a physician have a patient in the office and they're complaining of certain symptoms, and we don't know if ChatGPT is trained on data that might have an impact on the diagnosis based on a patient's ethnicity, for example. That's something that a doctor needs to know about in order to weigh that in his or her clinical diagnosis, right? So that's all that information is something that, from an in the office doctor-patient standpoint, we need to be taking into consideration. So if we can move to
The next slide.
Yeah, the next slide. Thank you.
Sure.
When we're talking about big data, which is, I think, the most exciting use for ChatGPT, to take all of this healthcare data that we have just sitting in various doctors' offices and other places, and aggregate it and learn from it and tell us these trends. I mean, that is such an enormously important use for healthcare. And we've seen with the Alzheimer's, mini study that they did, that this is possible. And we know from other AI examples that this is possible. And so if we're going to use ChatGPT in that manner, we need to either be taking de-identified data or have more controls over, the privacy safeguards in order to train ChatGPT. And then we get into the question of, if we do, in fact, train ChatGPT to do something like diagnose early onset Alzheimer's based on a patient's conversation with ChatGPT, and then ChatGPT is going to return some kind of recommended diagnosis. Like, we think with 85% likelihood that this patient does, in fact, have early onset Alzheimer's. That is something that the FDA would consider to be software as a medical device. So that would need to go through regulatory approval in order to be available commercially as a tool that doctors could use. And that is a complicated process. With AI such as ChatGPT, where we don't know what the inputs are, it gets really complicated. And there are AI companies out there that are already taking this data and having it analyze and return input that can make a recommendation to a doctor. But there's just so much testing that goes into that. It needs to be validated, it needs to be verified. And so that's a process, and it takes a lot of care, which is important when we're talking about potential life and death situations, right? Diagnosis and treatment takes a lot of care and consideration. I will point out that the FDA has somewhat adjusted its position on what counts as software as a medical device, and particularly when we're dealing with AI. So I don't know if maybe we can link to that guidance document somewhere.
Yeah, if you have it, you can either there's a post it in the chat in the bottom, and we can add that there on the far
Perfect.
right bottom.
Yep, got it.
That'd be awesome. And then they have some questions there if you want. If you want to look at some of the questions, or after you post it.
I don't see the questions. Can you?
Oh yeah, yeah. Were you able to drop it?
I dropped it. I might have dropped it in the private chat.
Oh, okay,
Drop
let
it in
me.
the comments instead.
Yeah, hit the comments.
Yeah.
And then when you hit the comments, and then I'll as you're doing that, we have a question. The first question says, "Can ChatGPT be used in a SOAP note for a complete and thorough note for diagnosis, treatment, and billing once I can confirm that it's used in a HIPAA compliant fashion?"
So, assuming it's HIPAA compliant, is this where we've got ChatGPT just coming in and collecting the information and creating the note
Correct.
based on the input that the doctor is giving?
Correct.
Yeah, I mean, that would be, if it's HIPAA compliant, then that would be fine. That's just record keeping, and that's completely acceptable, assuming, again, it's HIPAA compliant.
Got it. And what we're gonna do, I don't see the link from what you said, but if worst comes to worst, I'll add it to the show notes at the end, and then just tell me, and then I'll put it on there. The next question is from Sean. He says, "What about adding a privacy legislation to its training? Ask ChatGPT to provide a customized care plan or whatever in a compliant fashion with HIPAA." So basically, he's saying if OpenAI basically trained ChatGPT and then added the privacy legislation and laws to the algorithm. That way, when a provider, this is kind of how I'm taking it, a provider asks the question, would that make it HIPAA compliant?
No. And that's a really good question. So let's talk a little bit about that. ChatGPT knowing the law doesn't actually make it HIPAA compliant. So there are a lot of safeguards from a data security standpoint that go into HIPAA compliance. But let's just take a really basic one. Any data that you input into ChatGPT is no longer private. And this is something I read OpenAI's privacy policy, and they talk about the various situations in which they collect your data, of course. And it's not entirely apparent from maybe an ordinary user standpoint, in my opinion, that they are actually taking all of your inputs and they're keeping them. And I believe they're actually associated with your user profile as well. So, we've had situations where it's been very apparent that ChatGPT is using user input and disclosing it. And we had, I think it was Amazon, if I'm remembering correctly, their general counsel had to issue a warning to employees in the company not to put confidential information into ChatGPT because they were seeing other users have similar information returned to them. So they were seeing the information going in and then come out. Again, I think that was Amazon, but I would have to double check. And so that's an example of, even if ChatGPT knows the laws, that doesn't actually safeguard the data.
I'm going to answer this one. The next one is from Dr. Locke. "There's a company already trying to capture voice and converting it to notes. What is the value of adding ChatGPT?" From my perspective, the value would be let's just assume that it's up to date until the year 2021. that technically is not up to date, but being able, I believe that the next edition will be released probably in the next quarter, March, April or so. And I believe that added value is the following. If I knew this was in my capturing the votes, I'm looking at your notes here, voice and converting the notes, then it'd be huge because let's just say the patient said they have diabetes or I diagnosed with diabetes, just to be able to tap into the latest technology. Like today, the FDA just approved a whole system where the monitor of my glucose talks to my monitor of my insulin pump. That's never been approved, but some doctors may not know that that's out there and that's been FDA approval. That kind of information while you're seeing the patient in real time would be huge because now I can change my management in real time. So, next question. How can you ensure that the data received to train the data sets is unbiased? Unfortunately, that's her point. We cannot determine that. And unfortunately, with not having references, we don't know. And that's an excellent point. Is the users that are entering this data a particular race and looking at particular races? And unfortunately, is there other data of other races that is not being placed because maybe they haven't researched that or maybe it doesn't exist? And so that would automatically create biases. Good question. Let me look here. Some of these are long. I'll just randomly pick the next one. Uses patient input prior to clinical visits to capture elements and create notes. So it's another company. This is a little longer. As we discuss health education patient, we discussed the importance of nurses and doctors to communicate to the level of patients can understand. Only 43% of the working age adults in England don't have the literacy skills. Okay, so basically, I think Amy talked to me about this question. So Amy, this would be a great segue to talk about what on the ethics side, what do you think about that? He mentions in the study, some people don't have the literacy rate to be able to use ChatGPT and, the ethics involved with that.
Right. I mean, that's definitely true. And if I can modify that question just a little bit. So if you have a situation where a doctor is communicating with a patient and the patient doesn't understand because of an education level difference, and that happens, doctors are people, and it's hard to take complex ideas and simplify them sometimes. So to use ChatGPT to do that is definitely a potential use case. And I think that, well, I haven't thought about the ethics of that particular scenario prior to this, so
Yeah.
I'm not going to say with any certainty, but it is helpful in medicine and important to be able to provide care to patients that will actually benefit them. And if they don't understand what you're saying, then they are not going to receive the same benefit as a patient who does understand. So a use case wherein you're taking information and putting it into either a HIPAA compliant system or it's de-identified and having it simplify, like tell me this at the level of whatever grade level or in whatever language, is a fantastic use case, in my opinion.
Yeah, that's a good one. I'm going to share the next one. Thank you for sharing that one. The next one, how does the FDA regulate self-diagnosis tools for patients such as WebMD and other apps? What about using ChatGPT as a self-diagnosis tool?
Yeah, so I would say that WebMD is not a self-diagnosis tool. It is a resource. People can go on there and you can type in certain symptoms, and WebMD will provide information about conditions, and you can find out where that information is coming from. It's cited, and it doesn't tell you, here's what's wrong with you. So it's not a self-diagnosis tool, it's just an informational resource. And if you say, for example, you have a health app on your phone that is going to return a diagnosis or a probable diagnosis to you based on whatever input you're giving it, that would likely be software as a medical device, and it would need to go through FDA. And this is something that I've had, a lot of questions come up in my practice recently about this, because FDA has changed course on how they're regulating software apps that are consumer facing if they are tracking disease information, or certainly if they're returning any sort of diagnosis, that would need to go through FDA.
Thank you. That's good. The next one, let's see. Just a comment. Using ChatGPT to provide additional information to complete the doctor's, nurses, pharmacists' input could be useful. And that's kind of how I see it. I think just having that peripheral brain, having that extra additional information to answer. There was another comment from Dr. Locke, basically saying this. The comment that I made about the insulin pump. He says this is interesting news, but will it not change? Here, I'll put it up. Will it not change management nor add value to billing or coding or capture? What is it? What drives everything into EHR notes? So I see your point. I still think, again, I know Amy's here, but assuming we got the HIPAA compliance portion down, I do see value. If you're looking at it from a EHR point of view, I have seen some of the value in the sense that obviously working in the ER, there's a lot of legal issues and malpractice issues. Having that peripheral brain, having that in real time, being able to put in the symptoms, and it coming up with, I've seen software that already will give you that information. I know there's a particular doctor, I think his name is Dr. Sullivan. He created this amazing software that, from an ER point of view, it risk stratifies everything in the EHR. And so as I'm ruling out the differential diagnosis, having something like ChatGPT going in and feeding it more information in real time could be huge. I know, obviously, I'm not saying to replace the doctor or the human being. I think the human being, be it given in healthcare, it's a must. You can't replace the human in there, no matter how great the AI is. And so I personally think having that information from ChatGPT, just that extra brain, is huge. So, got some more questions. Let's see. I'll let you guys read that one. So, Amy, you want to talk about that one?
Yeah, so I'll have to give the lawyer answer. It depends. First of all, I don't know specifically what the situation is with OpenAI servers. I haven't looked into that. But if the company providing the AI is able to silo that information away from the rest of their model so that you're not having data that's entered go back into the system and be regenerated somewhere else, that's important. And then you would also need the company providing the AI to adhere to all the data security requirements that come along with HIPAA, and assuming that this is being used in a HIPAA setting and we're not dealing also with medical device setting. So could it be done? In theory, yes. And there are other AI companies that are used in the clinic that are HIPAA compliant. So certainly it's possible. With ChatGPT specifically, I'm not sure because I don't know their server situation. I don't know their data security situation.
Yeah, awesome. This is a great point, and I'll summarize for them. Basically, they're saying, obviously there's rare diseases out there, and ChatGPT can learn these from the medical journals and whatnot. But the way I see it, how I interpret it is, some of these rare diseases, some physicians may not be aware of, and having that peripheral brain that be able to look and listen and see that these are possible cases could even open the eyes of some doctors. And I think that would be a good use of, at least from my point of view, assuming, again, to make Amy happy here, that this is HIPAA compliant.
So I think that's a really good point. And one of the really, really important tools that AI gives us is the ability to aggregate all of this information, our big data, and to analyze it and to return it. And there's no reason that shouldn't be accessible to all providers. And that is really a big change that AI can make in healthcare. And it needs to happen. And I'm quite confident that it will happen very soon. So yeah, that's important.
Excellent. Looking to see, I don't see any more questions. Do you have anything else, Amy, in general, or?
No, I don't think so. If there are other questions that come up, we're certainly happy to
Yeah,
give
I'll
feedback.
I'll I'll wait a couple of seconds for it to pop up. All right, here comes another one. I'll just, without reading, I'll just put it up. Yeah, I'll let the lawyer answer.
Yeah,
And also reading the
I
next
just saw
one.
that come out too. I was trying to read on the screen. I should probably put my glasses on. So that is an interesting ethical question. And it is not assuming you just have a doctor in his or her office going into ChatGPT and inputting non-HIPAA protected information and then using it to help inform that practitioner's judgment is an ethical issue, not necessarily a regulatory issue. And there was a story that came out recently about this with mental health care providers using ChatGPT to come up with responses, and before
Oh
that
yeah,
information was then conveyed to the patients. And I mean, it's an important ethical question, and it's one that I think deserves more time for discussion. And I say that because it's something that it is really important. It's vitally important. There's a lot of bias involved. And when you have software that is returning a suggested diagnosis to a practitioner, it's so easy for that practitioner to rely on the diagnosis. And
yeah,
I think that is a big part of the reason why FDA has shifted their governance of AI in order to kind of subsume that where they didn't before. So FDA is saying that if a device is only going to support clinical decision making and not direct it, then maybe it's not a medical device. And it gets interesting when you look at what FDA considers to be supporting versus directing. If you have software that is returning a diagnosis, that is directing the physician's judgment or whatever practitioner's judgment. And that is something that I think does deserve a lot of conversation around it. And it needs to happen right now because we do have these products coming onto the market. And physicians need to understand how to work with them. They need to understand the shortcomings of AI, and so that they are better trained to use these tools.
I agree. I agree. We'll do the next question. What are the legal risks of using ChatGPT to summarize the consolidation of the PHI records for TEFCA requirements into a summary page for an individual?
Yeah, so again, this goes back to if you're taking HIPAA protected information and putting it into the software needs to be HIPAA compliant. And assuming it is HIPAA compliant, then yeah, that's a great use case. And you would obviously want someone to take a look at it and validate it, or have other measures that validate the software on a software level. But yeah, it's a fantastic use case. And I think that we'll see that very soon.
Great, thank you. We'll put this one. I can't know the answer to this, but I'll let you answer from a legal point. What if ChatGPT is considered a coach? Would it avoid HIPAA?
So HIPAA only applies in certain situations, in certain healthcare situations. And if you are providing coaching services, and you are outside of the HIPAA setting, then HIPAA doesn't apply. Um, if you want to be a health coach and you're not submitting for reimbursement or doing any of the things that make you a HIPAA covered entity, then HIPAA doesn't apply. And instead of HIPAA, we just have privacy regulations. And those are, the FTC has their data breach rule, various states have their regulations, but mostly that comes down to disclosure to the individual using the software, what's being kept, what's not, and adequate safeguards for cybersecurity. So yeah, if it could be used in a coach setting and HIPAA wouldn't apply.
All right, I'm gonna do the next one, and it'll be 2 seconds. Can you compare IBM Watson to ChatGPT? And the reason I mention it is I'm not, but I'm actually gonna invite Doug on the show in the future, and we're going to go over the different IT parts of it and go over different AI. So that's coming. The next one, the next three questions are actually good. Please share your thoughts, if possible, that ChatGPT replaces UpToDate at some point. I'll attack that one. I actually thought of that same thing. Can ChatGPT replace UpToDate? I think so. I think the key is going to be references, and I think I'm going to mention. I know we said we're going to talk about ChatGPT, but I'm going to mention DeepMind. They're coming out with Sparrow, and I think that will be what will ultimately replace UpToDate. I really do. I see the references and how they're doing it, and I think that is coming for sure. Let's see the next question. Knowing how people use Google to search and become an internet doctors about one's symptoms and diagnosis, ChatGPT will eventually also become a knowledge base for information. How do we ensure that the information and resources from ChatGPT puts out to the people is correct? Excellent question. And this is why we're here today, because I worry that this technology is out there, and like any technology, if it's used wrong and people don't understand, like I mentioned earlier, that hallucinational effect, then I worry that people might use this and say, "Oh, I don't need a doctor. I'm just going to use this." And I know outside the United States, they can get medicine. So that makes me a little worried, because what if ChatGPT told them, "Oh yeah, you have this disease and this is a diagnosis," and then therefore you ask it, "Okay, what should I take?" And it tells you, "Oh yeah, these are the common drugs that you take," and they go out to the pharmacy in those countries and just get it. And what if it's not the right diagnosis? So, how to avoid that? I think it's education again. I think it's all of us collectively saying, "Hey, don't do that. See your doctor, see your healthcare provider," and then creating systems that could replace something like that, like ChatGPT, that people would still use. So that's kind of my take. Amy, do you have anything else to add, or next question?
Yeah, I agree with that. And if if patients are going to do that, or people individually are going to do that, then they're kind of taking their care into their own hands.
Yeah.
And ChatGPT is not held out as a diagnostic tool, and so I think that's a misuse of the software.
Well, this is great transition to the next question. Dr. Aaron Smith says, can ChatGPT be held legally accountable if there's a wrong diagnosis?
I mean, no.
No, I agree with
Because
you.
again, and this is assuming that you've got someone say, I am going on to ChatGPT to try and diagnose some weird mark I have on my arm, right? There are so many disclaimers in ChatGPT that would tell me that this is not, it's not accurate necessarily. There are mistakes. It's in beta. It's not a diagnostic tool. Um, so it would be very difficult to be able to do that. I would have to show as a consumer that ChatGPT reasonably expected consumers to use it as this tool, and they did nothing to warn them that it shouldn't be used in that way.
Great. This is just a comment on the feed. It says, Dr. Aaron Smith, I'm curious too. These are cases around hold harmless clauses for vendor and CDS build. Ultimately, I think it would be the clinician that is found liable. I agree with that. I think ultimately, and that's our whole point in using this technology, ultimately, I'm hoping and my goal is that the doctor ultimately is the one that is guiding the ship, that is driving that ship, and say, hey, this is how this technology is used, but it's also giving its blessing. Amy brought up a good point the other day when we spoke. What if, from an ethical point of view, what if the doctor's not trained in this technology and they're using it? And I thought, I hadn't thought of that. That's true, which kind of brings me to the next point. I want to say there's only like 3 or 4 medical schools that teach this type of technology in medical school. And so, how much training do we get? So that there is a need out there for us to better understand this technology and better understand how we use it. So I don't see any more questions, Amy. Let me see. Did you have any more slides? I think, let me
I don't have
just,
any more slides, but I do want to add something to that last point.
yeah,
So physician training is really important, but also if we're talking about how a practitioner would be liable for medical malpractice or whatever kind of malpractice, if ChatGPT gets to the point where it's standard of care, that adds a whole new layer, because if a doctor is availing himself or herself of technology that is standard of care, then that's a really good defense in a
Yeah.
malpractice lawsuit. And, I spent 10 or so years defending practitioners in lawsuits. And I mean, it does make it a lot more difficult to make it the doctor's fault. But will we get to a point where ChatGPT is standard of care? I think it needs to be a lot more reliable before that can happen.
Yeah. No, that's an excellent point. I think we'll get eventually to that point. I hadn't even thought of that. That's actually pretty interesting. I could see us getting there. Will it be the next generation? I don't think so, but will it be the seventh or eighth generation from now? Possibly. I could see it getting to that point where it's robust. And I forget the other person's comment about rare diseases. I think those are the things. I know I always joke with everyone, like, I'm an ER doctor. I feel like I know a lot about everything, but I really don't know deep things. Like, I can't, do an appendectomy myself. So anyway, I think this might be our last question. Let me put it up. How much is being done to revamp training during medical school residency to embrace AI? I wish I knew more. All I know is that there are some organizations out there that are offering certificates for AI in medicine. I believe there's 2 or 3 that I saw, and I actually bumped into one today that it was, I forget the name. If I find it, I'll put it in the notes. But basically, it's a free course uh, put on by a medical school, and I thought that's pretty neat that they're doing that. I know I can't remember the other 2 brands that I saw, but I did see some training out there. So I do think it's important for us to know, and I am glad to hear that someone like you is asking about it. So thank you. Let's see. Arnold, I can't speak to the MD side, but the nursing side has really blown up with this, with it. I could see. Okay, there's the organization. Thank you, Doc. ABAIM.org. That's right. I'm really bad with acronyms, but yeah, this is a organization. I've seen their website and their speakers are amazing. So yes, I agree. I'm actually looking at possibly taking their course. They have one coming next week, so I may be doing that one just to learn more. Well, Amy, I'm trying to see if I have anything else. I really don't, and I'm looking. I don't really have anything else. Amy, do you have anything in general that you want to
I
share?
don't. No, and I just want to say thank you, Dr. Castro, for putting all this information out there and for having these interviews. I've seen you, of course, across platforms providing information, and I think it's really vital, and I really appreciate what you're doing.
I appreciate you. And I tend to be this pie in the sky thinker and think everything can be done, but I know I need to be grounded and have someone like you to tell me, okay, you can do this, but here's a roadmap, or here are the legal things that you need to get through. So I appreciate you. I really want to speak to that point. I think as a profession, both lawyers and doctors and healthcare professionals, we need to take this technology and be the leaders in this technology. Um, we want to make sure that we're driving this car and showing how it can be done and do it right. My worry is in the future, if we have bad outcomes, or people are using this technology the wrong way or unethical ways, or things like that, that this technology may get a negative rap associated to it. And then I would worry, in some cases we're hearing it being banned in New York City for education, which that's another story. But I would worry that if these things start happening, will our government come down? I know I read recently this week that Congress has said they're going to put a congressional committee together specifically for AI and making changes. And I would think, wow, that could change many things if Congress steps up and makes some laws. Have you heard anything else like that, Amy?
I mean, it's certainly being discussed, and there are committees that are forming to address it. But I mean, this is something that I agree with you. It's really, really important for the AMA and for other groups to get involved in this because we need a balanced perspective. And we have fantastic tools for AI and drug discovery that didn't come from Congress getting together. And I mean, they're not experts. They don't understand all the use cases for this. And it really needs to be the people who are involved in the day-to-day use or eventual use that are coming in and informing Congress and making sure that we have appropriate laws. So again, I applaud your involvement, and I hope that carries over to rulemaking.
Yeah, I'm going to post this interesting comment. basically, is a physician PhD, updating users, many creators, and rigorous peer review process. This sort of human judgment is key for shifting through misinformation and synthesizing literature for mission critical settings. As an NLP researcher, I'm very dubious that ChatGPT or any extension in the near future will be suitable replacement. I talk about ChatGPT and I sometimes use it as a generic term. I feel like this type of technology is going to be siloed. And when I say siloed, it's going to be very specific. And to make it my point, to make an example, say I'm going to make one up, say it's weight loss and there's certain drugs and there's certain things that need to be done. I feel like this technology is going to be used for a particular specialist for a particular problem, and it's going to be very confined to that particular area. And I see that coming sooner than later for medicine, and that's just my opinion. But other than that, I want to thank Amy for your time and everyone here, and know that this is going to be on YouTube, Facebook, obviously on LinkedIn, Twitter. So if you want to look at this recording later, feel free to refer to it. Please follow Amy, and if you have any legal questions, her firm, I have a feeling I'm going to be using it in the near future for some projects that I'm interested in doing to make sure that I am compliant with privacy laws and HIPAA compliance. And any other issues, just put in the chat and we see them, and then we'll put whatever links that people have asked for. But other than that, I'm going to end the show and say thank you so much. And I'm going to sign off, and I'm going to leave the video that started it as the ending point, and I'm going to take us down. So thanks again. Revolutionizing medicine with ChatGPT. How ChatGPT is changing the way we think about healthcare.
GPT, or Generative Pre-trained Transformer, is a type of artificial intelligence that has the unremarkable ability to generate human-like text. Keep in mind that this technology is currently in the beta testing phase. It is important to note the limitations. The quality of the responses depends on the quality of the prompts the user enters in GPT. The answers are not always correct. The answers are to be created to feel correct to humans. If the user does not know the area in question, then the answer might be incorrect, and the user may not be aware that it is incorrect. If the data entered is biased, then the data expressed by GPT can be biased. As a result, GPT may not be able to answer. One example of how GPT can be used in medicine is the creation of virtual assistants for patients. These assistants can provide personalized recommendations and advice to patients based on their medical history, current symptoms, and other relevant factors. For example, a virtual assistant could suggest over-the-counter medications or home remedies for a patient experiencing a cold or flu, or provide information on managing a chronic condition such as diabetes. Another potential use of GPT in healthcare is in the creation of personalized treatment plans for patients. By analyzing a patient's medical history, current symptoms, and other factors, a GPT-powered system could generate a customized treatment plan that considers the patient's specific needs and preferences. GPT could also help healthcare professionals with daily tasks, such as transcribing medical records or generating reports. By using GPT to automate these tasks, healthcare professionals could save time and focus on more important tasks, such as caring for patients. For example, a GPT system could be trained to transcribe patient medical records accurately and efficiently, freeing up healthcare professionals to spend more time interacting with patients and providing care. Additionally, it will be important to consider privacy and security concerns when using GPT in healthcare, as sensitive medical information will be involved. Measures such as encryption and secure data storage will be necessary to protect patient privacy and ensure medical data security. Physicians are already using this technology. The most popular example that went viral is on December 13, 2022. Dr. Clifford Sturmer posted on TikTok on using ChatGPT to save time with insurance denials. Get you the care they need. In the video, he asked ChatGPT to write a letter to United Health asking them to approve an echocardiogram on a patient with systemic sclerosis. Make references to supporting scientific literature and list the appropriate articles. It is important to note that he later posted a video telling healthcare providers to check the references that GPT yields. He notes that it is better to cite your own known reference to use with GPT. Overall, GPT has the potential to greatly improve the efficiency and effectiveness of healthcare by providing personalized recommendations and treatment plans to patients and helping healthcare professionals with their daily tasks. While there are challenges to overcome, such as the need for accurate and up-to-date data and concerns about privacy and security, the use of GPT in healthcare holds great promise for the future. Some possible future applications of GPT in healthcare could include using GPT-powered chatbots to provide mental health support to patients, or using GPT to generate personalized exercise and nutrition plans for patients based on their individual needs and goals. GPT could also be used to help healthcare providers with tasks such as scheduling appointments or managing patient records, making the healthcare system more efficient and effective overall. The potential for GPT in healthcare is vast, and it will be interesting to see how it is used in the coming years to improve patient care and the overall efficiency of the healthcare system.
Thanks for watching, and please follow me at Harvey Castro, MD.